Hi, my name is Dr. David Marquis, and I just wanted to take a few moments on this video to introduce to you our approach to treating patients who are suffering from fibromyalgia. Fibromyalgia has commonly been looked at as a garbage can diagnosis for anybody who's suffering with chronic pain and some fatigue, brain fog, gastrointestinal problems. There's so many different overlapping complaints that get kind of packaged together with fibro that the list gets quite long. Well, also traditionally, these patients have been shoved off to the corner of doctors' offices and often treated with antidepressants or a variety of different pain meds, or just said, you know, we don't know what's wrong with you. These patients actually do have problems, and I really do enjoy working with them when they're motivated themselves to find a solution, as long as they haven't given up. That's really the bottom line, because every human being has that potential in them to heal. And I want to tell you that patients suffering from fibromyalgia can heal. They just need to look at it in a comprehensive fashion, and that's what we offer our patients, to look in a comprehensive way, both metabolically and neurologically. The metabolic side to fibromyalgia has been looked at for a couple of decades now, and treated sometimes with moderate amounts of success in working with magnesium therapies or upregulating an individual's oxygen levels. But more often than not, you see that there's not a long-term solution for these individuals. Many times in their metabolic care, there's an autoimmune aspect too, and it seems to be the key. And then they improve for a period of time, and then they start to go back to their baseline of the pain that they were suffering from. Well, we look at patients from that metabolic side, but we also complement it with a complete neurological evaluation. And it would appear that without those two pieces to the puzzle, the fibro patient is going to continue to dwindle in terms of their outcome. Now, our brain drives every cell in our body. And in fibromyalgia patients, there's some things that appear to have gone wrong with the brain. When you look at the brain stem, you can kind of break down three different levels. You've got your mesencephalon, you've got your pons, and you've got your medulla. Now, just about everything that we do, whether it be sight, sound, taste, smell, balance, our speech, all of these things are going through this portion of the brain. And they're sending out different impulses depending on what the stimuli is. Something has gone wrong in many of these fibro patients where these signals from the mesencephalon start getting sent down, and well, the pons and the medulla, they're supposed to be kind of the brakes to the system to slow that down, those impulses. What happens is there's a failure to put the brakes on, so to speak. And that mesencephalic output starts to stimulate the adrenal glands to put out more catecholamines. And when our body gets bathed in these catecholamines, we experience pain. Now, that brain portion sometimes was treated successfully for brief periods of time with antidepressants. So people say, oh yeah, this was my solution. I feel better when I'm on this. But unfortunately, those antidepressants didn't change the neurochemistry of the brain enough so that the pattern actually changed. And then you start to get into that, well, I got to titrate my dose up to get to the same level of relief that I was at before, so maybe my problem's not solved. Well, one of the things that we do after we determine, okay, what portion of the brain do you have not functioning, and how much of a metabolic side do we need to complement? So we treat both of those sides with nutritional therapies, making sure that there's no autoimmune components that I mentioned previously, and that has a lot to do with diet. Then we can start feeding that neurological side, making sure that there's enough fuel, appropriate glucose metabolism, and appropriate oxygen. Oxygen is huge. And we manage the oxygen levels by looking at, okay, is your oxygen saturation appropriate, as well as your perfusion? And that's where the ball really gets dropped often. We'll look at our oxygen sats and we'll say, well, yeah, I'm 99 to 100. I've got good oxygen. Test your perfusion index. More often than not, these people who are suffering, they're not perfusing even 10% of their available oxygen. It's like being out in a boat in the ocean. You got water everywhere, but you can't drink any of it. You've got oxygen bound to your hemoglobin, but it's not getting delivered to the cells. That's your brain. Your brain can help with that if you retrain it. So we have therapies where we help people to upregulate their oxygen delivery, exercise with oxygen therapy, glutathione, nitric oxide, and then specific exercises. It's actually quite fun once you start to see that you're feeling better to realize that you can retrain and improve various deficits that you've had. You start to lose that fibro fog. You start to have improved name and number recall. You remember why you're walking into a room. Yeah, you left your keys there and you remember to pick them up. Life starts to improve when you've got your fuel and activation banging on all 8 cylinders. And that's really what we do here, and that's why our approach is quite different from the traditional medical approach to treating fibromyalgia. We're not looking for a magic bullet. We're looking for the comprehensive answer to what went wrong and combining that with a comprehensive package of therapies, both neurological and metabolic. If you're suffering from fibromyalgia or you know someone who is, I encourage you to give our office a call. We've got a wonderful staff at the front desk just waiting to help. These ladies, they will bend over backwards to make sure that your needs are met. Take all of the lab that you've ever done, bring it into us, fill out the comprehensive intake package so that I get an idea of who you are and what's gone on in your life, who you used to be, and what's that person that you want to pull back out that you used to enjoy. Because so many of us, we feel like our health is dwindling to the point we'll never get back there, but don't give up that hope. I usually don't talk about hope a lot, but in the fibro case, I've seen so many people have given up hope, and I encourage you not to do that, because there are answers out there. You just need to be patient and ask the right question. So please give us a call if you find that you're suffering from these things, and I look forward to meeting you, and I wish you the very best of health.